Hi, I'm Dr. Marian Owen, and I am giving you guys a quick June update. We were planning to take the month off for June. Susan and I both have vacations and conferences and things that go on in June, and so we aren't putting out a full newsletter, but there have been quite a few breaking stories about how COVID is transferred and how things are working out in the community as things are loosening up. So I wanted to do just a quick update and answer a few questions that I'm getting as we move through June of 2020 and all of its chaos. So first, I hope that you are all well. I hope that you all feel safe and have found ways to communicate and connect with the people you love, to check in on them, finding ways to be together that feel safe to you, and are just finding a way to enjoy this absolutely glorious spring that is continuing. Crazy cool early start to our summer here in Georgia, and that despite everything that's going on, that you're finding ways to put your energy into the world in a way that feels positive and constructive. Even if you can't go to gatherings, or if you're inclined to go to protests, if you feel unsafe doing that, which I fully understand, figuring out ways to engage in the events that are happening in ways that make you feel connected and important, and that you aren't just sitting home feeling stuck in things. So I encourage you to look for those opportunities and to try not to just fester in the anxiety that this spring and summer are thrusting upon us. So updates on COVID. First, it is becoming very clear that the major form of transmission of this virus is from someone's breath through the air to a recipient who is then inhaling it. Less so does it seem to be that it's on surfaces, that it's transmissible through those surfaces. Certainly it is detected on surfaces, but that doesn't mean that the virus being there is able to then get into the human body and be there in enough numbers to produce and create an infection. So the surface transmission seems to be less important. And that's important to know because things like people were worrying early on, well, how long do I need to leave the mail in the mailbox before I bring it into my house? Or if I get groceries, do I need to clean them, or how do I clean them? And all of those things seem to be clearly quite secondary and probably not that important to protecting yourself from COVID. So we can relax about those things, and that's good. That's great. Anything we can relax about feels really good right now. So that's good. But the air is critical. So one of the things that's important, I think, as we realize that, is that when you are in a space with other people and you don't know their potential exposures, you want to minimize the time that you spend rebreathing air that they have breathed. So you want to be at a very at least 6 feet. I'd like to get a shirt that says "Please stand 6 feet back," and I think that distance is proving out to be both obtainable. I mean, we really can't have a conversation with someone at more than 6 feet. We're going to start to yell at people across the room. We can't do that. But also, in a normally sized space, we can be comfortably 6 feet apart from someone and have conversation with them. So 6 feet's doable. Even in the grocery store, if someone's in an aisle you want to be in, you can wait. I'm trying to go to the grocery store during times when not as many people are there so that I have that opportunity. That means getting up earlier, going later, but that's, again, it's doable. So if we all continue to space that out and don't crowd in on Sunday afternoon, that is probably the safest thing to do. So the other piece of news that I found fascinating and really important and positive is that it is clear that masks work. Even these homemade, simple, it doesn't have to be an N95 approved sealed mask. These work. They don't work by when you wear it, you don't get sick from someone who's breathing. It's not going to block particles from coming into you. But if you're breathing out or coughing, having this very close to where the air is exiting from your mouth catches the vast majority of those particles, which means that it prevents you from spreading it to someone else. And that's great, because I don't want to be the reason someone else gets sick. But I also would prefer it if everybody were giving me that courtesy. And not everyone is. And that is both frustrating and frightening, and I think can be anger provoking. And I think that one of my own personal tasks is to not feel angry when I am in a space and someone else is not wearing a mask. I'm not walking their walk. I don't know all the things that are going into those decisions, but it does feel like they're choosing to not care about me, and that bothers me. I mean, that's just the kind of thing that bothers me. So I am hoping that all of you are choosing to wear masks when you're out in public. They are very, very effective. There was a report in one of my daily journals that there were 2 workers in a Great Cuts, or whatever they're called, haircut places, and they in this one store tested positive for COVID, were found to have were sick. And so in the time between when they were diagnosed and went home and probably got sick, it was determined that they probably had about 140 potential people they could have exposed, which that's terrifying. But that's how many people were exposed. Among those people, because both of those employees were wearing masks like this one, just a simple little fabric mask. There's no special filter in here. It's just 2 pieces of cotton. But because they were wearing this kind of mask, nobody caught it from them, which that's amazing. So we're in a situation now, at least in Georgia, where our governor has decided everyone can and therefore must go back to work. So if everyone in your place of work is wearing one of these, if you're one of those people who has to go to a place to do your job, wear one of these, and you are within absolute reason and within all that is not crazy to ask everyone in that space to wear one of these whenever they're at work. I do not understand why that is not a law as we are returning to public spaces. It just does. I don't understand why our governor is not saying that. Yes, we have to reopen. The economy has to go, blah, blah, blah. But the economy is going to come to a crashing halt if we re-spike all of our COVID cases. And we're going to do that because people aren't being told they have to wear this. You shouldn't be allowed to go into the grocery store without one of these over your face. I don't care what your political standing is. COVID doesn't care either. This is absolutely shown to prevent transmission of COVID. And that's what we should all be trying to do, to not make other people sick. So, as you are moving through your day, you wear your mask. You show that you care about your fellow human beings, and it does provide a small amount of protection for you. You stay 6 feet away from anyone not wearing a mask. Stay 6 feet away from anyone you don't know, even if they're wearing a mask, if you can. But that 6 foot distance is an unmasked distance. So those things are really important, and that's effective. So do that for yourself. Now, as we are coming into these times where people are realizing, I've been locked in my house for 3 months, I can't do this for 15 more months or whatever it's going to take until we have an effective treatment or vaccine. Each one of us is having to make a calculation about what exposures we're going to have and give to other people. And so as you're making decisions about that, remember that your decision doesn't just affect you. It affects everyone you're going to be in contact with. And what we want to do is we want to continue to keep our social circles small so that should we get sick and become infectious, there are fewer people we can expose to the virus. But we also want to think about the social circles of the people that we have to be in contact with. So if you have to go to work with someone who cares for their elderly parent or their handicapped child, and is very, very worried about COVID, it is socially responsible for you, even if you're not going to get very sick from it, to continue to restrict your exposures so that you don't add to the exposures of those other people. And that's you really need to think about what is my contact circle, and how do the decisions I'm making affect those people in my contact circle. So as you're choosing to go out and about, you're going to the grocery store, you're going to a protest, you're standing in line for 20 hours to vote because you live in Georgia, whatever the contact you're going to have is, you want to then think about, for the next 2 weeks, what contacts do I need to not have so that I don't expose someone to something I was potentially exposed to when I couldn't avoid the contact I just had. So just be thoughtful about that. Again, if you wear your mask, you're much less likely to pass something on to someone that you don't intend to. So I strongly encourage that. But I do encourage you to start putting your toe back into the water of getting back into the world a little bit. Again, we're going to need to wear our masks. We're going to need to socially distance, visit with people outside when you can. The virus doesn't do very well outside, so that's great. Sunshine is a great healer. So have coffee in the morning with a friend on your back porch. Those kinds of things you can safely do, as long as they are also being reasonable and careful about their own exposures. People who are choosing not to be, I think you need to just say, I can't see you now. But you can also do things like go for hikes. This weekend we went up and my vacation week, we went up to see my dad. We were with my dad in a mountain cabin for the week. It was wonderful. We rented a boat one day. And that was great. We were outside, we were in the world, we were together, laughing, having fun, but in a way that felt very safe because there weren't a lot of added exposures. One day we went hiking, and the hiking trails were a little bit more crowded than I liked. We had our masks, but nobody else did. And when we were in a more crowded area, we would put it on, but I didn't wear my mask when it was just me and my dad on the trail, because there's no reason to. So, just being reasonable, being thoughtful about what exposures you're going to have, but also how can you fold back into those pieces of your life that are important, that give your life meaning. Look for ways to start to engaging that feel safe to you. And as always, if you're not sure, if you don't know what the level of risk is, or if it's worth doing, and you want to just think that through, you can always give us a call. We're happy to try to help you figure that out. We will be back with a full newsletter in July. Susan is going to write something up on brain health. And it was hard for me to remember that, so I will pay attention to that one. And we will have more updates as things happen. And as always, if you have any questions, please reach out to us and know that you are loved here, and we want to do everything we can to help you stay well.